Okay, so this session is being recorded and it's sponsored by the USC Emeriti Center. And we are partnering for our wellness events. And I would like to introduce you to Professor Elena Bassett. And if you could just give us a little bit of a background about where you're from and how long you've been at USC, that would be wonderful.
Absolutely. Well, thank you for having me this afternoon. My name is Elena Bassett, and I am in the Department of Otolaryngology. I am an audiologist, but I have a PhD in dizziness. So I'm a dizzy doctor at the end of the day. My specialties are in vertigo and the diagnostic assessment of the inner ear for concerns of dizziness and imbalance. And I have been with USC since 2018. I spent my entire academic career at the University of Nebraska Lincoln. So, all 10 years. I started in 2008 as an undergraduate, and I loved it so much. I stayed until 2018 when I finished my PhD. And during that time, I had the opportunity to work across a variety of settings, including academia with a research interest at that time in concussion and concussion assessment. But I also had the opportunity to run a clinical practice, and that kind of is reflected in my current experience here at USC. I spend 4 days a week in clinical practice as the director of the USC Balance Center. And then I have a day a week for research where I pursue my research interests in fall prevention, actually, and fall interventions. We all have our favorite balance activities, and for me, that's yoga. So, as if we think about our hearing and balance organs, they help us navigate on our day to day. And hopefully, following this presentation, we can think a little bit more in depth about our hearing and balance organs and their participation in the enjoyment of our environment. Obviously, in 2020, we found ourselves in a very unique situation, everybody's first global pandemic. And with that, not only a global pandemic, but a respiratory one at in this kind of current condition. So our faces are covered with masks. We're doing everything we can to protect our nose and our mouth from inhaling or kind of being exposed to these concerns. And with that, we didn't necessarily realize how that would impact our ability to hear or our ability to understand when we're in these different environments. So we're going to touch on that today. As an audiologist, we are focused on the ear. So our ear is actually divided into three parts. We have our outer ear, which is visible from the periphery. Our outer ear is a collection tool, which allows us to collect the sound waves that are moving through our environment. Those sound waves transverse down our external auditory canal, which then hit our tympanic membrane. When they strike our tympanic membrane, they move the ossicles or the bones of our middle ear. So the dividing factor between our outer and middle ear is actually our tympanic membrane. We often think about our tympanic membrane when we have a perforation or we have a child that perhaps receives PE tubes or tubes in their ears. That is the position or that is the placement of where those tubes would go or where the perforation would occur. The external ear canal is also the home of the cells which create earwax, which is a common thread through all of us here. Some of us may have very, very waxy ears or collect a lot of earwax, and those cells live in the outer kind of 1/3 of our system. When we think about using a Q-tip, this is the place where that Q-tip will be inserted. And we often advise against using Q-tips because naturally, wax is going to actually travel out of our ear. And when we use a Q-tip into our ear, it actually pushes it down and compacts it. So Q-tips are something that we suggest using in your outer ear, as in the ear that we observe in our pinna. But inside of our ear canal, it can be a bit more treacherous as we don't want to perforate that tympanic membrane. Beyond the tympanic membrane, we talk about the bones of the middle ear, and the bones of the middle ear serve to turn our mechanical stimuli of our sound wave and transmit it to our inner ear, which is a fluid-filled sensory organ. The bones of our middle ear are our malleus, our incus, and our stapes, also known as our hammer, anvil, and stirrup, maybe from elementary school if you remember that. The bones of our middle ear and the space of our middle ear is often the component where we are sometimes experiencing ear infections or fluid or pressure buildup. And that fluid and pressure buildup is something that we like to have drain down our eustachian tube. So when you find yourself popping your ears, perhaps when you're on a flight, or if you are experiencing a change in significant pressure when you're traveling over the mountains, this is the space that is opening and closing to relieve the pressure in the middle ear. We finally get to our inner ear, and this is the home of both our hearing and balance organ. The sensory system, which transmits and collects our sound wave information from our auditory system up to our brain via the cochlea, and the home of our balance organs here, which are responsible for interpreting the position of our head in space as we move through our day. The first part of our conversation here is in regards to the hearing organ or our cochlea. And we are going to dive into that sensory component right now. As we consider this, our hearing organ is responsible for interpreting our auditory stimulation as we move through the day. The cochlea is filled with hair cells. And these hair cells are not like the cells that grow on your head. These hair cells will not regenerate. They are specific to frequency. So if we consider this, we have hair cells that are designated for low frequency information, if we were to think of the low notes of a piano, and hair cells that are designated for high or mid frequency information, the high notes of the piano or the mid notes of a piano. Every time we hear a sound, that sound travels to the cochlea and stimulates the frequency that is related to it. All sounds will be transmitted through the cochlea, through the entrance of the cochlea here. And as a result, we often see breakdown in that initial part of the cochlea over time. A lot of wear and tear on those hair cells. And unfortunately, with that, a significant amount of perhaps hearing loss. This is obviously a spectrograph or an internal picture of the cochlea between the two slides. And as you can see here, these fine fibers running throughout the length of the hair cell have been changed or absent in this hair cell or in this cochlea, that shows us a picture of a cochlea that has been damaged with excessive noise exposure. When we are thinking about excessive noise, we obviously enjoy things in our environment that can be incredibly loud. Maybe we had a opportunity to attend a lot of concerts prior to COVID, or in our youth enjoyed a number of different concerts or activities. Maybe we worked in a loud job, maybe running mechanical machinery, or have a pastime that involves firearms. All of our noise exposure over time is additive. So anything that you have done in your past to your present will continue to change and erode your hearing organ in a way where we start to develop hearing loss. Hearing loss related to age or related to noise exposure typically influences our high frequency information to start, or our high frequency hair cells to start. This is due to, the fact that the high frequency hair cells are located at the entrance of the cochlea. So every sound that you ever hear throughout your life will pass through this region, and over time will be attributed to the wear and tear of that organ, and unfortunately, the loss or the change of that sensory information. As we think about hearing loss can occur for a variety of different reasons. It may be congenital in nature, where you are perhaps born with a change in your hearing organ or components of your hearing organ that do not function the way that the normal system would tend to function. And as a result, you may need some assistive technology and or alternative communication strategies to help. I see a question coming in here in regards to sound waves and light waves. And with that, our sound waves are changes in pressure or the air molecules as they're moving through space. So it's a kind of a mechanical stimulation. Light waves, I wish off the top of my head I was more savvy to answer that question. But I know that it's also a sensory related organ. That's a beautiful question. And it makes me think that I need to go back and look at light waves for a moment. So I apologize. When we consider the processing of these sound waves, are symptoms of hearing loss, something to let us know that perhaps we're not hearing the world as well as we did before. Perhaps our cochlea is not as sensitive, is that we can experience a muffled or distorted sensation to our perception of sound, where we are perhaps hearing what is in our environment, but it is not clear, it is not crisp. It may sound like people are mumbling or that we are almost underwater. We can have difficulty, hearing environmental sounds that are soft, like birds singing or the tick of the seconds of a clock, the sound of alarms within our environment, the sound of the telephone ringing, or even the doorbell. We can have difficulty understanding speech during telephone conversations or participating in large groups. Speech is a very complex stimuli, and speaking on the telephone, we typically do our best in communication and in conversation when we can see the speaker in front of us and we can observe their lips and their face. On the telephone, we don't necessarily have that option, so we're relying purely on auditory cues. And if we know that there has been a change in your hearing or in your hearing organ, and those auditory cues need to be louder or perhaps have um, an amplification to them, and we're not getting that through the telephone, we can really struggle. And also in group conversations, when there's multiple speakers and you may have difficulty determining which person is speaking around you, uh, the ease of conversation can be obscured. We can also experience ringing in our ears related to hearing loss. And ringing in our ears is known as tinnitus. It can occur, or tinnitus, however you want to say it is fine. It can occur related to loud noise exposure, but it can also be related to changes in hearing over time, possibly due to the aging process. And tinnitus is thought to be a central process where there has been a change within our auditory complex of our brain, and now we're generating some type of sound that we're perceiving and tapping into. Tinnitus can be objective or subjective in nature, and typically individuals will perceive this internal sound most often at quiet at night, when they're laying in bed, because we don't have other external auditory stimuli to keep our auditory system busy. We note that hearing can be tested by an audiologist or by another hearing healthcare professional, perhaps a hearing aid dispenser, or even at a screening through a health fair. And we often put our results on something called the audiogram. If you were to ever receive a hearing test, you most likely saw X's and O's plotted on a graph across frequency and across loudness. I provided an audiogram here of everyday environmental sounds to kind of give you an appreciation for how loud things are in our world relative to the sounds, speech sounds of the English language across frequency, as well as other environmental sounds such as a bird chirping or a jackhammer. Hopefully, you're not running into too many of jackhammers on your day-to-day basis now. But when we consider this, our audiogram allows us to look across frequency. So our low notes or our low frequencies designated to this end, testing up to our high frequency range on this end. Typically, an audiogram that you would receive in a traditional hearing test will go to 8,000 hertz because that is the kind of end of the spectrum of speech of the English language, what we're generating on a day-to-day basis. Across the side, you'll see loudness with our softest sounds at the top here and our loudest sounds at the bottom here. What we note is that for normal hearing in adults, we typically think anything coming in at 25 or above is considered to be hearing within normal limits for a average adult. And the way that you test that, or the way that we can test that, is that we would have you sit in a sound booth. We would put earplugs or headphones on your ears, and we would have you indicate by either raising your hand or pressing a clicker at the softest beep or the softest tone at each of these frequencies. And we would plot that. For hearing loss, we often can determine whether your hearing loss is occurring because of age-related processes relative to the cochlea or the nerve. This is called a sensorineural hearing loss, meaning that it is most likely permanent in nature relative to a sensory change with those hair cells or the nerve traveling up to the brain. Or it can be conductive, meaning that when we think of that picture of the outer, middle, and inner ear, the conduction or the ability of that sound to move through the space has been compromised in some way. And your audiologist should be able to tell you the type of hearing loss, whether it is sensorineural, conductive, or mixed, a combination of the two. The degree of hearing loss, how severe the hearing loss is that you're experiencing, and how it's configured. Hearing loss, when it is plotted, can have different shapes to it. Typically, in adults who experience age-related hearing loss, we'll see a high frequency hearing loss where it will dip or shift in our high frequency range. If we think about this, hearing within normal limits runs about 25 dB. So when we have a change in high frequencies, a person may have normal hearing through 2000 hertz, where we are able to pick all of the sensory information in that region and pick up on all of these good speech sounds. But then we may see a decline or a significant decrease in hearing in the high frequencies. And with that, it would clip off our speech sounds like K, F, S, T, and H. The way the speech spectrum is presented, sounds like K, F, S, T, and H are soft in their tone or their intensity and reside obviously in that high frequency range. They're very important for clarity and crispness of speech. So you may have very, very good hearing in the low to mid frequencies. So things sound just as loud as they ever have before to you. But at times things may seem muffled or mushy in some way because we are not able to access the consonants that give us clarity and distinction in sound. In our low to mid frequency region here, the vowels and consonants that give us loudness and intensity to speech, that is where they reside. It is not uncommon to also experience hearing loss in these regions, depending on how your hearing loss is being generated. And with that, when we start to experience hearing loss in these regions, we note that things seemed turned down in level, the clarity and the loudness have been compromised, and it could be that you're a candidate for some type of amplification. As we consider hearing loss, it's important for us to also think about cognition. Being able to hear and being able to connect with your environment is very important, especially when it comes to our social relationships. If we are within a large group, or if we are in a setting where we are perhaps participating in a conversation, or attending church, or attending a conference, attending a journal club or a Bible study, we want to engage with the people around us and have that dynamic conversation, which we all enjoy. But at times when we have hearing loss, we often withdraw from participation because we're not quite sure what is being said, or we're not quite sure maybe the topic of conversation that we're on at that point. Hearing loss can be challenging because your brain may always be trying to figure out or determine the missing components. If we're having a conversation and you are going to the grocery store for someone and they're asking you to pick up a bag of carrots, but you only hear go and grab a carrot, that's a big difference. So your brain is always trying to fill in the information that you are missing, and it can be very challenging and it can be very fatiguing. And as a result, we might just withdraw in order to kind of protect ourselves from that. If you're finding that you're withdrawing from conversation or you're withdrawing from participation because you're just not quite sure what's being said, it could be um, time to pursue amplification or pursue some type of evaluation of your hearing just to determine where you are at in regards to hearing loss. I'm seeing a few questions here come in regards to the conversation that we're having here. And one of the questions is in regards to an English speaker versus Spanish. And we know that obviously with our different languages, different dialects, even within those languages, the presentation of the speech spectrum will be different. So in English, this is how the speech spectrum is played out in regards to our frequencies, but obviously in Spanish or in other languages that are maybe tonal in nature, we can see the distribution of these vowels and consonants be spread or be presented in a different way. So it could be that different components of the language are compromised or changed due to the preference of hearing loss. Okay, I mean the degree of hearing loss, not the preference, excuse me. And there's another question here in regards to ESP or extrasensory perception involving physical waves or something else. That is a fantastic question. That is Mr. Lau, you are throwing me some beautiful questions today that are making me think in a different way, and I appreciate that. ESP, I'm not quite sure. And that is, I'm going to admit that. Extrasensory perception is not something that I'm incredibly familiar with. I feel like those individuals are incredibly sensitive to any type of like electrical or physical stimulation within their environment, perhaps sound waves, but that's something I'm also going to have to look into. My email is at the end of this, so you may need to email me these again so I can respond to you directly when I dive into some research. I appreciate that. And I think this next question kind of helps us think in a particular way. So when we are considering hearing loss, like we talked about, can be related to environmental sounds over time. I think the question we have from Della here is a great also lead in that hearing loss can occur from other factors within our environment as well. Different combinations of prescription medications, specifically prescription medications ending in mycin, can be ototoxic, meaning toxic to the sensory hair cells within the cochlea. And as a result, we can experience hearing loss related to the intervention that we are receiving for another health issue, especially in individuals who have received chemotherapy or other types of chemotherapeutic agents. Hearing loss can occur later, after the intervention perhaps has passed, up to months, even years following. So, if you're an individual who has perhaps received some of these drugs and has experienced some type of tinnitus or change in your hearing, um, it's something to consider in regards to just monitoring your hearing and paying attention to that. When we think about hearing loss, and we talked a little bit about intervention, the intervention at this point in time is relative to um, a kind of technological advancement in hearing aids as well as implantable devices. And hearing aids at this point in time, the technology is advancing in a way where we have extended wear devices that can actually be placed deep inside of the ear canal and remain for a few months in duration until the battery wears out. There are in the ear devices, which are daily wear devices that you can take in and out. And depending on your degree of hearing loss, there is an appropriate fit for you. So, in a question here, we have an individual who has good hearing in one ear, perfect hearing in one ear, and then diminished hearing in the other. Will a hearing aid work? It depends on the degree of hearing loss in the ear that has had the significant change. When we consider that, if the significant change is enough where we can intervene with a hearing aid, you could perceive some benefit and hopefully some balance between the right and left ear. If the hearing loss is significant enough where you could benefit from an intervention such as a cochlear implant, which is an implantable device where electrodes are actually thread through the cochlea, and we use electrical stimulation on an external device that collects sounds and then transmits that to the cochlea. That could be an option as well. Bone anchored hearing aids are actually based on vibration, also. They are adhered to a surgical abutment that is placed in the skull and causes a vibration within our hearing organ that allows us to hear that mechanical stimuli, but through an intermediary factor. Changes in our hearing aid technology have advanced in a way where we can service a wide variety of hearing losses and in turn provide individuals access to sound that may not have had the opportunity prior. The goal with hearing aids is always to think about, or any type of amplification, providing access to that speech spectrum. And as we consider providing access to the speech spectrum, we are not going to amplify everything in your world, everything in your environment, just what is related to your hearing loss. Hearing aids are expensive, right? They are a major, major investment. So the goal is to find something that works for you and really take it for a test drive. When we consider this, hearing aids are expensive because the technology is always competing. They're always aiming to modify the computer chip inside because it is a computer. And these manufacturers are constantly competing to provide the highest level of technology, the best computer chip, and they're expensive because of the research and development that goes into that. As a result, though, on the consumer end, it can be a challenge to obtain hearing aids, especially if you have some financial constraints. Medicare does not cover hearing aids. But if you have a Medicare supplement or maybe a secondary insurance, always be savvy to check to see if you have benefit. Because at times, although Medicare will not cover the insurance, most insurances do have an insurance benefit associated with them, where you could get some or all of the cost covered for the device itself. So if you found yourself maybe feeling prohibited to pursue amplification because of the cost associated with it, that is something to be mindful of at the end of the day. The latest development in the regeneration of the serial hair cells and the stem cell tech is a constant competition and a constant drive. And we're finding that we have many labs working on the regeneration of hair cells. And that is one of the main goals of our department actually here at USC. The Department of Otolaryngology, under the leadership of Dr. John Ogilvie, is striving to cure hearing loss through these kind of therapeutic ways. And from the question asked here, David, I would love to connect you, maybe via email, to Dr. Ogilvie to touch base on some of that new and latest development and technology. Because at the end of the day, although hearing aids are beneficial, it's not the cochlea itself. We're not using the same sensory organ in the traditional way. So how do we get those hair cells back, excuse me. We have a question here in regards to chemotherapy and hearing loss. And I will say it can be related to the chemotherapeutic. The hearing loss can be related to the therapeutic agent itself, related to the chemotherapy, or in other cases related to the mycin drug, specifically gentamicin in particular. Okay, as we consider this, we often find now that we are not necessarily just communicating with each other face to face in our homes, but often via video communication. And with this, it can present its own challenge. Hearing loss is very sensitive to kind of appropriate audio and visual communication. And we see here that our internet connection needs to be stable. If there are lags or disruptions, it can obscure the auditory component. So maybe you see the individual's face moving, but then there's no audio. And that can be very hard, especially if you have hearing loss. We find as well that we can be participating one-on-one with family member communication, but also family members can be in the background and perhaps distracting to us in some way. So having a few people on the conversation can be beneficial. We also can be competing with distractions and competing noise. And as a result, that can obscure or make it challenging to have effective video communication. The lighting and setting is a key feature as well. I try to position myself to have a plain background because if I have a lot of stuff that's busy happening behind, it can obscure the actual visual cues that I'm trying to communicate through the screen. And if I have a light straight behind me, it can actually, I'll show it here. If I scoot back here, I have this light here. If I have a light straight behind me, it can really distract and obscure from my face and maybe make it challenging to see my full physical features. So with that, we often try to make sure that we're with a plain background with a kind of simple, clear lighting in order to facilitate that. You may find that you're also doing a lot of telemedicine where you're visiting with your physicians in that way. And as a result, if you're having a hard time maybe seeing your physician or hard time understanding your physician, maybe asking them if they can move locations or kind of get in a frame where it is clear for you to visualize their face, that is important. If you're having challenges in video communication and you're having challenges in regards to just overall understanding, there are some speech to text apps that can be helpful. I will say that the Ava app, if that is something that could be of help to you, helps to make subtitles, not only for spoken communication, but also for audio-visual communication like this, to have the subtitle run on the bottom, because we are finding now that obviously for specific populations and for specific groups, it is helpful to have subtitles supplement the visual conversation that we have here. But these speech to text apps can give us an opportunity for, if the visual communication is obscured, we can have the written communication to supplement that. We note now that masks can cause some increased difficulty with hearing and understanding. And why is that? There's a couple different components. The physical mask itself does, in a way, turn down the volume on your speech. So with the simple surgical mask, the blue mask that I have here, we note that it can turn down the volume about 3 to 4 decibels, which is enough, especially if you have hearing loss in that high frequency range and the clarity of speech may become obscured because we're losing those vowels and those consonants that give us crispness and distinction. These larger N95 respirators, which are those kind of more complex masks. Excuse me, I have one in my bag here. This is my new kind of wardrobe. But these masks, the N95 mask obscures up to 12 dB. So if we notice here, as I continue to talk to you, that my voice becomes more muffled or more clear depending on the position of the mask on my face. In my clinic setting currently, I'm wearing an N95 with the surgical mask over. So is that additive in nature? Perhaps. But what it's also doing is it's obscuring your ability to visualize my lips and my face. Our ability to see the visemes or the movement of my lips helps to supplement what you are hearing. We're not just hearing with our ears, we're understanding and hearing with our brain. And as a result, having the visual cue in conjunction with the auditory cue is incredibly beneficial. So as I'm talking to my patients in clinic now, and I have all of this over my face, it can become incredibly challenging to have a clear understanding of what is being said. So those clear masks, if you're trying to protect yourself, can be beneficial. Or if you're working with someone with hearing loss, having a face shield can also be a benefit because the visual cue is so important. I have a few questions coming into the group chat here, which I want to give some time and opportunity to discuss. But we actually have a little breakout session built in here where I wanted to give an opportunity for you all to connect in regards to some concern of hearing and balance, or hearing function. And then we're going to dive into balance, which will address the concern about having possible hearing and balance problems. As we think about this, we're going to break out into sessions for 7 minutes here to talk about how you are perhaps optimizing your communication cues while wearing a mask, and how, I'm gonna do an opportunity here. I'm gonna allow you to unmute yourselves. 1 minute here. Okay. Well, can someone try to unmute themselves here? Oh,
Yeah,
fantastic.
that
Oh,
works.
fantastic. I didn't want us to get into the breakout rooms and have it be complete silence, which is very possible at this point in time. So it's 2020, anything can happen. So we have the opportunity to go into these breakout rooms and have a conversation in regards to the couple things that I talked about here. How we have the ability to optimize our communication cues when we're wearing masks, as well as how does hearing loss influence your ability to communicate effectively with friends and family members, okay? So I think if I could get help from my co-hosts, if it is
I
possible.
unfortunately don't have the ability to do breakouts.
Even better. Okay, that's
Only
fine.
you can as the host.
Only I can. Well,
yes, you have the
appreciate that.
power.
I have the power. It's a strange thing to have, but we can make it happen. So what we're going to do here is I'm going to randomly sort you into breakout rooms, okay? And with that, we are going to go there. We're going to go there for 5 minutes. Sound like a plan? And then we're going to dive into some balance session. Okay, here we go. 1, 2, and 3. Creating breakout rooms. I'm opening the rooms. I look forward to seeing you in 5 minutes. Go ahead and join those rooms. To start the recording here. It is not uncommon to have concerns of both hearing and balance because of the close relationship between the two systems. In diseases such as Meniere's disease or possible inflammation of your hearing and balance nerve, we can see a change in both systems. In fact, when you experience vertigo or the rotational movement of your body, whether it's you or the perception of the room moving around you, it's related to your balance organs. We find here that your balance organs, your vestibular system, is integrated within your balance system. Your vestibular system, like we said, is responsible for determining the position of your head in space, but that information is communicated to your visual system. Your visual system provides us the opportunity to have a clear view of the world around us and decide the safest path to move from point A to point B without hazard. This is also communicated with your somatosensory system. Your somatosensory system is the system that is responsible for interpreting the sensation of your feet and ankles, deciding what type of surface you're on, and what muscular changes you need to make in order to stay upright and to stay safe. These three components serve as like a triangle. They're constantly working together to keep you upright and to keep you safe without harm when you're moving from point A to point B. If you think about your overall health, if you've had significant changes in your visual system, your vestibular organs and the sensation in your feet and ankles have to work a lot harder to navigate or help you navigate as you are walking or moving through your day. If you experience peripheral neuropathy, where you've had changes in the sensation of your feet and ankles, we note that your visual system and your vestibular system are going to need more information to keep you safe as you're changing from walking on grass to gravel to concrete. This balance system can change with age, but if we have a significant change to our vestibular organs, we note that the reorganization of the system may need to be facilitated or helped with physical therapy. The vestibular system, like I said, is tied to the visual system through the vestibular ocular reflex, which keeps your head stable as you're moving through space, is tied actually through the neck, through the vestibulocholic reflex, which keeps our head and neck muscles stable as we're walking, and the vestibulospinal reflex, which is the reflex that helps us brace ourselves when we fall, allowing us to put our hands out to stop ourselves if we're becoming unsteady. We often note that changes in our balance system can be described as dizziness. And dizziness comes in different flavors. And I think it's important when you are talking with your physician about dizziness to be able to describe exactly what is going on. Are you experiencing dizziness where it's an impaired spatial orientation? It's distorted around you. Things just don't seem quite stable, quite right. Is it syncope or near syncope, where you feel as if you may pass out or lose consciousness? That is most likely cardiovascular in nature. So we want to get you to the cardiologist at that point. Is it vertigo? Are you perceiving that you are in rotation or the room is in rotation around you? Or is it unsteadiness, where you feel a sense of instability as you're moving through your environment from point A to point B? You can have all of these things. You can have one of these things. But often in the umbrella term of dizziness, we can lose patients, meaning that we weren't really describing what we were experiencing maybe accurately, or we didn't have the language to do so. So at times, individuals may visit 3 or 4 providers before actually making it to me to have their balance organs checked. When we consider this, instability can often lead to falls, and a fall actually has a definition. It's a sudden, unintentional change in position, causing an individual to land on a lower level, on an object, on the floor, or on the ground. And it is not related to a sudden consequence or a sudden onset, like being pushed to the ground or having a seizure. We actually define falls. If you were to stand up from your chair and try to push yourself up and out of your chair and fall back down into it, that would be considered a fall. We often think of falls as maybe larger or more devastating events, but they are the little incidents that happen in our day where we lose our balance. And while we were trying to stand, unfortunately, came to rest when we did not mean to do so. So it is possible to have multiple falls, perhaps in a day or in a week, and not necessarily realize it. Falls are a leading concern and the leading injury of non-fatal accidents and injury in older adults over the age of 65. And unfortunately, they're one of the leading causes of death as well. An accidental injury or a fall or accidental injury related to a fall can lead to a more devastating consequence. We probably know someone, each of us, who unfortunately has fallen and maybe broken a hip, or fallen and broken their arm or their wrist, and as a result has maybe made a lot of changes lifestyle wise to accommodate that. Or perhaps you are afraid of falling. And that fear of falling can limit your ability to perhaps do some activities or some different events that you enjoy to do in your environment. So falls can not only have physical consequences, but social and emotional consequences if we're holding back perhaps from doing activities for the concern of possibly injuring ourselves. There are many intrinsic and extrinsic risk factors related to falls. Intrinsic risk factors being things within ourselves that can increase our fall risk, including hearing loss. If we have a significant amount of hearing loss, perhaps we cannot hear environmental changes around us, such as we have a pet in our environment and that pet sneaks up behind us and we step backwards and fall over them. Or if there is a significant amount of visual concerns that we're correcting with glasses, or cognitive concerns where we're maybe not maybe as able to navigate our environment safely, these intrinsic factors can add together and increase our fall risk. Where extrinsic factors are things that are in our environment that are just naturally dangerous for us at times. So having poor lighting or loose rugs or objects around our home that are untethered can cause us to trip or slip or fall inadvertently. As providers, we often try to address as best we can all of the extrinsic factors, everything that is modifiable to keep you safe and to keep you healthy within your environment, while looking at some of these intrinsic factors as well. But what can we make change to help prevent or help reduce the risk of future falls? When we consider our kind of overall hearing and balance function, a audiologist or provider can help to navigate or help triage you to the appropriate care path. Do we need to address a risk of falls as well as hearing loss? Hearing loss alone? Are you experiencing symptoms of dizziness and unsteadiness for an extended period of time and are curious about how your vestibular system is functioning? That is something that the Department of Otolaryngology can assist with. But in regards to fall prevention and fall intervention, building up strength in your legs and muscles, or helping improve those extrinsic risk factors, the USC Department of Physical Therapy, the Physical Therapy Associates, and the Department of Occupational Therapy are tremendous resources to help you determine how to become more stable in your day-to-day, and how to build your confidence safely. We think about all of these factors, and it's a lot to go over in an hour. But the hearing and balance organs are complicated and have a lifetime of experience in regards to your sound exposure, as well as maybe some other things that have occurred in your life to influence these structures. So getting an evaluation or looking into that and thinking about how these organs impact your day-to-day activity is hopefully something we can generate and start to think about following this conversation. I recognize that I ran close to running over. It's a complicated system. That's why I went to school for so long. It's just those two little pieces have so much to them. But I'm happy to take any of your questions at this point in time, whether they be in that kind of organized way, Jeanette, however you want to run this. And I appreciate you for letting me talk to you guys this afternoon. I hope it was a benefit.
David has a good question. And we can stay a little bit longer for those who'd like to stay a little bit longer, and we'll continue to record it. And then once the recording is available, then people can revisit that. We're also going to see what we can do about getting the text.
Absolutely.
Right. So for those who weren't able to hear it, maybe we'll be able to have the text recorded, the audio part recorded. But David says, is there any chance that someday an accelerometer-like device, like in your cell phone, can replace a faulty vestibular system?
That is a beautiful question. So I'm actually typing my email. Oh, I'm typing my email here to everyone. So you can have my email back here. I apologize, everyone in meeting. The accelerometer, or the goal of having that type of accelerometer device, is in progress. So similar to the cochlear implant, there has been the development or the goal of making a vestibular implant, which would electrically stimulate the vestibular system with mechanical changes in the head. This is a new technology. This is an exciting technology, but there are some bugs to work out. Our vestibular system obviously can be manipulated in a way where we can feel vertigo, true spinning sensation, and that's relative to the neural firing of the vestibular organ. In these early cases, sometimes when they give them too much electrical stimulation, individuals can be thrown up against the wall. So we need to be very careful about that and hijacking that system. We are intrigued, though, on how do we help, or how do we replace or develop strategies to improve compromised hearing and balance organs. And that accelerometer, that electrical vestibular system, is something that we are looking into. You may also find that there's accelerometers in your watch, or you may have heard of hearing aids that have accelerometers within them that are looking at falls and fall prevention. And that technology is up and coming. It is new. The key is what do we do with that information once we collect it? If your Apple Watch has recorded falls on it, are you providing that information to your primary care physician? Are you seeking intervention because of that? So we need to make sure that we get that information to the right people at the end of the day. We find that, and in going off of our vertigo question here, dizziness is related to nausea and vomiting because it is related to our autonomic nervous system. And as a result, we are primed to feel that gastrointestinal distress. We break out into cold sweats. We get clammy hands. We feel like we may pass out. Lots of patients will experience extreme nausea and vomiting. And just like when we feel kind of that intense motion sickness, it's all related, and it can be very yucky. And often patients will go to the emergency room in severe bouts of vertigo to manage the symptoms of dizziness and nausea and vomiting. When I'm looking through some of our questions here, And we're thinking still in that line of that vestibular system. We talked about the angular motion of the head being registered by the vestibular organs, but the vestibular organs are also dependent to gravity. There are two organs within the system known as the otolithic organs, and they have components in them which are gravity sensitive, made of calcium. Have any of you ever experienced something called a BPPV, or benign paroxysmal positional vertigo? Or has anyone ever told you the crystals are loose in your balance organs? Loose crystals. I see some hand waving. Crystals on the loose. They're sneaky, guys. These are actually the gravity sensitive components of your balance system becoming loose within the semicircular or angular canals. And as a result, when you turn or move your head, the crystal moves within the canal and tricks your brain into thinking you're in motion. So you feel a spinning sensation. This occurs because that crystal is sensitive to gravity. So when you tilt your head up and back, or bend down to tie your shoe, or roll over in bed, that angular motion is being interpreted, but also the gravity sensitive crystal, which is out of place, is also being interpreted and pushing the fluid. As a result, you experience vertigo lasting for seconds to a minute in duration. It is not uncommon and is one of the most common causes of dizziness in older adults. When we are considering some of the other questions that are coming in here, I have questions that are kind of ear specific related to the cochlea. And one of them is about tinnitus, the ringing in your ears. That is a very common auditory concern. And for tinnitus, we want to think again intrinsically and extrinsically. Intrinsically, we could have hearing loss that is contributing to the ringing in your ears. So it'll be important to have a hearing evaluation. We also want to think about any prescription medications that you may be on that can be exacerbating or have tinnitus as a side effect. Also, caffeine, alcohol, tobacco, and salt can all exacerbate or increase the perception of tinnitus. Externally, you may notice that when you are busy or when there's a lot of background noise, you don't necessarily perceive the tinnitus as much. So having some sound generators in your environment, instead of completely being in the quiet, can be helpful to help reduce the perception of the ringing in your ears. One of the earliest interventions for tinnitus, if you have hearing loss, is actually hearing aids, because they provide a continual auditory stimulation in the region of hearing loss where perhaps your tinnitus is being generated from. So that is something to consider. Oh, I'm going back here. We had some question, also a question in regards to earwax and managing that at home. So earwax is natural, it is important. Some of us enjoy digging in our ears with Q-tips. It is not uncommon, but that causes an impaction of the wax typically. There is an over-the-counter product called Debrox, D-E-B-R-O-X. It comes in a green container. It is an ear drop. It is a tool to use to help loosen debris, loosen impaction if you are experiencing impacted earwax. Another method that has been mentioned and described to me is that we are experiencing, when we are in the shower, to let a little bit of warm water run into your ear and let it sit there for a moment, and then to turn your head in the other direction, as this warm water can loosen or release debris within the outer ear and within the ear canal. So that is something to consider. Obviously, if you have a significant amount of earwax impaction, visiting with your physician can be beneficial to really just help get that out, whether with a pick or with like a water stream or like a jet. We are cruising here. If you have any concerns related to your hearing or balance function, an evaluation is helpful. For the hearing, we're not at the point where we can replace hair cells yet, but a hearing aid can be of benefit. And it may be coming across to you that there are hearing aids that are sold through offices such as ours at USC, but you may also be hearing conversation about over-the-counter products or personal amplification devices or PSAPs. And these are coming on the market. And what we find is that these devices can be beneficial to a point, depending on your degree of hearing loss. So over-the-counter devices may be a great entry-level device if you have a mild or a moderate hearing loss. When we get into greater degrees of hearing loss, the technology may need to be a little bit more precise and or refined in order to address your hearing healthcare needs. So over-the-counter hearing aids are definitely becoming competitive when we think about the price point. They're at a price point where a lot of people can get access to hearing aids efficiently. And we note that I mean, for me personally, I'm incredibly excited about these options because I know it'll connect more people to the amplification that they need at the end of the day, because it definitely is a challenge. And when we consider that, look out for that. It'll be happening here shortly. I saw that even with the latest iOS update for the iPhone, that if you have AirPods, you can modify the AirPods to kind of serve as an amplification device. So players such as Apple and such as Bose are coming on to the over-the-counter market, and we may be seeing more of these over-the-counter type hearing aids in the near future. We find that if we're having concerns with our balance function, there are exercises, there are physical therapy strategies that can help us improve our balance function as a whole. So there's a special subset of balance therapy called vestibular and balance rehabilitation that focuses solely on reorganizing your vestibular system, your visual system, and your somatosensory system. And there's a component of that that's related to fall risk. So allowing us to determine your balance confidence and your balance ability and improving upon that to prevent future falls. All right. Is everybody still with me? Is everybody still here? Okay. Hello. Yes, I see waving of hands and hands up. Are there any additional questions that you would like to ask? I want to be respectful of your time on a Friday afternoon, November the 6th, which is has felt like the longest week, the time change and the election and everything else going on. But are there any other questions that you have? No.
I have a quick one.
Yes, please,
So,
Katie.
in the 80s, when the headphones first came out, when our Walkmans came out, you know, we were supposed to keep them quiet so nobody else could hear.
Yes.
Is that still the recommendation in this modern day of iPod buds and or like I use a headset in the mornings when I walk and I listen to books on tape, and I'm always a little concerned that, you know, the headphones only in one ear, but you know, I do that to drive, and that I'm hurting my hearing in my left ear. So do you have a recommendation for the volume on, you know, headphones or iPods so we don't hurt our hearing?
Absolutely. So I think when I first went into my audiology program at Nebraska, we were having a lot of conversation about iPods, because there's a high level of concern that like teenagers were going to have this incredible wave of hearing loss because of our just addiction to listening to music all the time. And in the past 10 years, or not 10 years, it hasn't been 10 years, I guess, in the past like 4 or 5 years, we use earpods and headsets almost all the time. And you're tapping into something, Katie, that I think a lot of people are thinking about is like, I am constantly with something in my ear. I'm either talking through headphones to someone on the computer, I am listening to music, I exercise with headphones. And with that, it's not only about the volume, but the dose. how loud for how long. So you may be listening to all of this at a mid or a lower level, but you may be listening to it for about 12 hours a day. That's a long time for your auditory system. At 8 hours a day, maybe in a work day. But when we think about that, giving your ears breaks, giving yourself an opportunity to listen naturally and not having something in your ear can be beneficial. Thinking about the capacity of keeping it about halfway volume wise is a good rule of thumb. If you are an iPhone user and you maybe have AirPods or talk through your phone, or you listen to music through your phone and things like that, within the health app, if you have that, if you go to browse, there is a hearing tab, and you can do many things with it. But one thing it has is it has this thing called headphone audio. Oh, sorry, those are my steps for the day. As you can tell, it has not been a very productive step day. One moment, it was the wrong thing here. It has something called headphone audio levels. And what it does is it plots it over time. So checking in with that every so often can be beneficial, because
I
if
got
you're
an okay.
yeah, see, you're okay. Great, fantastic. Over and under using that can be a challenge. Bill, I see your hand is raised here. Go ahead and ask.
Yeah, this is not really a question, just a statement.
Yeah.
I've discovered that with my hearing loss, these new thing, I think they're fairly new bone conduction earphones make a real difference. And
Well,
I got some from Amazon a couple of weeks ago, and they really improved the hearing, and especially where I have the loss of one ear.
I think, Bill, you're savvy to recognize something here, where when we use bone conduction, it's very similar to that bone anchored hearing aid.
Yeah.
Where we're actually vibrating the mastoid bone. And as a result, it's stimulating both the right and the left hearing organ. Even though it's only maybe to one side, the bone vibration will go to both cochleas. So for you, it is probably going to your ear with hearing loss, but also being picked up by your better hearing ear. So you're seeing a lot of benefit with that bone conduction device. Bone conducted headphones are actually really cool. They have those glasses now. I think they're Bose. You can listen to like music and the radio, but also wear glasses, and it's bone conduction. That's maybe where the technology is headed. Discrete hearing aids. And hearing aids are incredibly discreet now. They're not bulky and chunky like they were before.
Yeah, the headphones are not very expensive either. They're on Amazon, and they're about the same price as any other headphone, but they do make a difference, I've discovered.
This is true. And Calvin, you're right. When dentists are doing any type of dental work, they are dealing with bone conduction as well. There was a period of time where we were thinking about using something called a sound bite. I think it was a company, and they may have, bless me, gone under, but they were using bone conduction devices within the teeth to transmit like telecommunications. So it was like a savvy way for like Secret Service or military to receive transmitted informations without having any type of external device visible. Keeping on that volume kind of conversation, I would say for Zoom meetings, to have the recommended level is as loud as you need to hear and understand appropriately. Think of it like the TV. If you have it at full blast and you're still having difficulty understanding what is being said, it could be possible that we need some type of hearing test, because you could have hearing loss. For like playing songs for students or turning up the computer volume, just do it at a level where you feel appropriate. Playing it loud, but thinking about the dose, how long you're playing it for. I know in the time of 2020, who would have thought we would spend so much time in these type of situations? So are there any other questions? I hope you're feeling well balanced. And if anything, I hope you are maybe a little bit more aware of your auditory system, especially as we are continuing to move through this year and into next. I don't think masks are necessarily going away anytime soon, especially when you visit with your physicians. So if you're finding that you're having a difficult time understanding your doctors, especially for the important conversations that you need to have with them, using those speech to text apps can be incredibly helpful, and ask for clarification when you need it. We're still having big, important conversations, and we want to make sure that everybody has the opportunity to access them appropriately. If you have questions for me, please feel free to email me. I hid my email within the chat, and I'd be happy to answer your questions with anything you may have in regards to hearing or balance or how you need to move forward. Oh, thank you, Leanne, for redoing that. I appreciate that. Anything related to hearing or balance, and I appreciate that you let me come and talk to you. Even though I'm not a USC graduate, I am now found a special part of my heart for USC after leaving Nebraska. So thank you.
Thank you. We thank you so much for doing this, and it's been so informative. And if you think of any websites or resources after the questions that you've received, and we do have the chat session that I can forward you the text in the chat and all of that. So if you have recommendations for some of the things like bone conduction and loosening earwax and those kinds of things, we will be following up and sending a thank you email and an evaluation for this session.
Absolutely.
To those who've attended. So it's a good way to stay connected and to learn more.
And as we think about the chat, if you don't mind sending me that conversation, so I can really go through and kind of address it on a case-by-case basis, I would appreciate that. So thank you.
Happy to do that. And we will be there. I believe we get a transcript of the audio too that's in text. So
wonderful.
We can provide that along with the recording once that gets uploaded to the cloud.
To the cloud. Excellent. Well, I'll send it to the cloud here shortly. I'll stop the recording and we'll be ready to go. Thank you, everyone.
Thank you so much. Thanks everyone for joining us, and take good care.